Hello, this is the Unit 4, Module 12, Chapter 24C presentation. Salmonella species cause enteric fevers such as typhoid fever. They can cause septicemia, and they're one of the most common causes of bacterial enterocolitis in the United States. Salmonella are gram-negative rods that do not ferment lactose, but they produce hydrogen sulfide, features that are used in their laboratory identification. Salmonella antigens, including cell wall antigen O, flagellar H, and capsular virulence factors, are important for taxonomic and epidemiological purposes. Enterocolitis is characterized by an invasion of the epithelial and subepithelial tissues of the small and large intestines. Salmonella organisms penetrate these tissues, and the resulting inflammation and diarrhea are caused by them. The dose of Salmonella required is very high, at least 100,000 organisms. Stomach acid is a very important host defense against Salmonella. Salmonella infections are prevented mainly by public health and personal hygiene measures. Proper sewage treatment, putting chlorine in the water supply, cultures of stool samplers from food handlers to detect carriers of Salmonella, hand washing prior to food handling, pasteurization of milk, and the proper cooking of poultry, eggs, and meat are all important in preventing Salmonella outbreaks. In typhoid and other enteric fevers, the organisms enter the body, multiply in the phagocytes of the Peyer's patches, and then spread to the phagocytes of the liver, gallbladder, and spleen. This eventually leads to bacteremia, with the onset of fever and other symptoms probably caused by endotoxin. Survival and growth of Salmonella typhi within phagosomes in phagocytic cells is characteristic. Salmonella can also invade the gallbladder, and colonization there can result in the establishment of a carrier state and excretion of the bacteria in the feces for long periods of time. Campylobacter bacteria can cause a variety of inflammatory conditions. Campylobacters are motile, non-spore-forming, curved, gram-negative rods. Campylobacters are found in the GI tracts of many animals that are used for food, including poultry, cattle, sheep, and swine, and in the GI tract of many household pets, including birds, dogs, and cats. These bacteria usually do not cause illness in their animal hosts. Campylobacters are transmitted to humans in raw or undercooked food products or through direct contact with infected animals. Ingestion of contaminated poultry that has not been sufficiently cooked is the most common mode of acquisition, between 30 and 70% of cases, in the United States. Fluid and electrolyte replacement is the key with Campylobacter infections. Antimicrobial therapy is usually not carried out. The prevention of Campylobacter includes washing the hands before preparing food, especially after handling raw poultry or other meat. One should thoroughly wash with soap and hot water all food preparation surfaces and utensils that have come in contact with raw meat. Poultry products should be cooked to an internal temperature of 170 degrees Fahrenheit for breast meat and 180 degrees Fahrenheit for thigh meat. Unpasteurized milk or unchlorinated water, unless it's boiled, should not be ingested, and hands should be washed routinely after handling pet feces or touching animals. Clostridium difficile infection, abbreviated CDI, is a unique colonic that is acquired almost exclusively after antimicrobial use and the consequent disruption of the normal flora as a result of the use of antibiotics. The most commonly diagnosed diarrheal illness acquired in the hospital, CDI, results from the ingestion of spores of Clostridium difficile that vegetate, multiply, and secrete toxins that cause diarrhea and pseudomembranous colitis. Clostridium difficile is an obligately anaerobic, gram-positive, spore-forming bacillus, whose spores are found widely in nature, particularly in the environment of hospitals and chronic care facilities. CDI occurs most frequently in hospitals and nursing homes, where the level of antimicrobial or antibiotic use is high, and the environment is heavily contaminated by Clostridium difficile spores. Spores of toxigenic Clostridium difficile are ingested, survive the stomach acid, and then begin to grow vegetatively and colonize the lower intestinal tract. They elaborate two large toxins, toxin A, which is an enterotoxin, and toxin B, which is a cytotoxin. These toxins of C. difficile disrupt barrier function, cause diarrhea, and they cause pseudomembrane formation. When possible, complete discontinuation of antibiotic therapy is recommended. Biotherapy by way of fecal transplantation can be used to treat recurrent Clostridium difficile infection, which is thought to reestablish the normal colonic microflora. The cure rate using fecal transplantation is close to 100%. Of the viral agents that cause enteric infection, rotavirus, a double-stranded RNA virus with at least 8 different serotypes, is the most common. As with most viral pathogens, rotavirus affects the small intestine, causing voluminous watery diarrhea with no pus or blood. The incubation period for rotavirus infection is between 1 and 3 days. The symptoms caused by rotavirus include vomiting, a low-grade fever, and that very watery diarrhea. The diarrhea usually lasts between 4 and 8 days, but may last longer in young infants or in immunocompromised patients. The treatment for rotavirus infection is nonspecific and supportive, and it basically aims to replace the lost fluid and electrolytes, especially in small infants. Prevention of infection occurs primarily by good hygiene and preventing fecal oral contamination. A vaccine is available and recommended. It's a bovine-based pentavalent rotavirus vaccine, and it's usually given orally to infants at 2, 4, and 6 months of age. Norwalk virus, also known as norovirus, is one of the most common causes of viral gastroenteritis in adults, both in the U.S. and worldwide. It's named for an outbreak of gastroenteritis in a school in Norwalk, Ohio in 1969. Norwalk virus has a non-segmented, single-stranded, positive polarity RNA genome. It's non-enveloped with an icosahedral nucleocapsid. There is no virion polymerase associated with it. Norwalk virus infection is typically limited to the mucosal cells of the intestinal tract. Watery diarrhea is the result. Norwalk virus is also transmitted by the oral fecal route, and it's often involved in the ingestion of contaminated seafood or water. Typical outbreaks of Norwalk virus occur in group settings such as cruise ships, especially in the Caribbean, schools, camps, hospitals, and nursing homes. Infection is enhanced by several features of the virus. Norwalk virus has a low infectious dose. It's excreted in the stool for several weeks after recovery. And Norwalk virus is very resistant to inactivation by chlorination and to drying in the environment. It's thought to remain infectious for several days on environmental surfaces such as door handles. There's no antiviral therapy for Norwalk virus infection, nor is there a vaccine. Fluid and electrolyte imbalance caused by the vomiting and diarrhea may require intravenous fluids. Again, personal hygiene such as hand washing and public health measures such as proper sewage disposal are helpful. Hepatitis is an inflammatory disease marked by necrosis of liver cells or hepatocytes and a mononuclear response that swells and disrupts the liver and its architecture. It occurs when certain viruses infect the liver, and it causes jaundice when bilirubin accumulates in the blood and tissues. All these human hepatitis viruses, hepatitis A, C, D, and E, are RNA viruses, except for hepatitis B, which is a DNA virus. All types of viral hepatitis produce clinically similar illnesses. First, let's start with hepatitis A. Hepatitis A infection is far milder and shorter term than the other forms, producing vague flu-like symptoms. In some cases, infection may include jaundice and swollen liver with darkened urine. Hepatitis A is not an oncogenic viral infection. One can expect a complete and uncomplicated recovery after infection. Hepatitis A is a non-enveloped 27 nanometer heat, acid, and ether-resistant RNA virus. It's in the hepatovirus genus of the picornavirus family. The virus replicates in the GI tract and then spreads to the liver. But the virus does not kill liver cells. Any hepatocellular injury is caused by immune system attack by cytotoxic T cells. Hepatitis A virus is shed in the feces, and it is spread through the oral fecal route. The hepatitis A virus is relatively resistant to disinfection procedures. There's no antiviral drug available. Prevention is obtained through a vaccine that contains killed virus. Administration of immune globulin during the incubation period of hepatitis A can reduce the symptoms. Hepatitis B symptoms may include fever, chills, malaise, anorexia, abdominal discomfort, diarrhea, and nausea. Hepatitis B is transmitted through blood, semen, and vaginal fluids. Some patients with hepatitis B will develop glomerulonephritis and inflammation of their arteries. Complete liver regeneration and restored function occur in most patients who recover from hepatitis B infection. A small number of patients can develop chronic liver disease. Hepatitis B is an enveloped virus with incomplete circular double-stranded DNA. The injury to hepatocytes with hepatitis B virus infection is due to immune attack by cytotoxic CD8 T cells. Antigen-antibody complexes cause arthritis, the rash, and glomerulonephritis. About 5% of hepatitis B virus infections result in a chronic carrier state. Chronic hepatitis, cirrhosis, and hepatocellular carcinoma can occur. The hepatocellular carcinoma may be related to the fact that part of the viral hepatitis B DNA integrates into hepatocyte cell DNA. The HBs antigen on the surface of hepatitis B virus is what specifies the virus's tropism for the liver cells. Hepatitis B virus is transmitted once again by blood. It can be acquired by infants during birth, and it is spread through sexual intercourse. Hepatitis B virus establishes chronic infections, especially in those that are infected as infants, and it's a major factor in the eventual development of liver disease and hepatocellular carcinomas. There are three main approaches to prevention of hepatitis B infection. Number one is a vaccine that includes not only protection against hepatitis B, but protection against hepatitis A. Also, hyperimmune serum globulins that are obtained from donors with high titers of HBs antibody or antigen, and the education of chronic hepatitis B virus carriers regarding precautions to spreading the virus to other people.